So when you saw the title of this video, whatever it's going to be, the title of this article is Crack Pipe Distributors Received More Than $5 million in Federal COVID Loans. Did you think, well, that is probably just some fake news? That is so ridiculous. There is no way that can be true. Or did you think, oh yeah, I know all about this. I mean, it's pretty common thing, just pretty regular thing. The government gives out just, crack pipes and all kinds of crazy stuff for drug addicts to just, shoot themselves to kablooey. Maybe you did both. Maybe you're like, it seems like that's a crazy title. That's what we're talking about today. And the reason we're talking about it is I covered this podcast a while ago on the booty bumping kits. If you don't know what that is, well, I mean, your life is not complete and you need to stay to the bitter end of this podcast. All right. Before I jump in, if you're new here, welcome. My name is Sean Reynolds. I own a couple of real estate companies, and some say that I read news for reasonable people. You're reasonable. I'm reasonable. This is not a reasonable topic. We need to talk about it. So crack pipe distributors, they got $5 million in PPP loans. Now, let's be honest. Let's be reasonable. One of the reasons you tune in here is because I'm going to say, all right, so these companies aren't just crack pipe distribution companies. There's no such thing. They are companies that deal with services to the homeless and to those who've got massive drug addictions or anything in between. And that there's a concept called harm reduction, where if we know that we're going to be dealing with people doing drugs, let's make it as safe and let's make it as conducive for their welfare as possible. Meaning you basically enable their drug use. I'm a huge no-go on the concept, enormous no-go. This is not how you help out people. You don't help them out by, oh, you're an addict? Oh, okay. Here's a little paraphernalia to make your drug usage just a little bit easier. That to me is like, but you've got all these organizations like, it seems like a good idea. They're going to do it anyway. So why don't we just give them some drugs and some paraphernalia? I'm sure they'll be better. They're good people. Well, they are, but they need you to say, no, that's what they need. They need help getting off the stuff. Nobody wants to be on drugs. Nobody wants to be stuck on drugs. Some people want to party and they want to live that lifestyle, but it really comes right down to it. If they have the choice, all right, it's not going to be terrible to get off drugs, but your life is going to change. They'd probably take that option. The problem is with most opioids, it is terrible to get off drugs. That's why you've got a little thing called detox. Ever talk to a drug addict about getting through a detox? Yeah, tricky at best. Getting all that crap out of their system. Very, very hard. So several nonprofit organizations that distribute crack pipes as part of smoking kits received PPP loans during the COVID-19 pandemic, a daily caller analysis of loan filings found. They identified 8 organizations that received PPP loans and distribute kits with pipe components or a fully assembled smoking device. Since when is it okay to hand this stuff out for free? That to me is just, it's just one of those things where it's a total head scratcher, because I kind of come from the other side of things where, all right, that person's got a drug addiction problem. You do all these steps to kind of help them. You get them through detox. You get them into you get them through the program, whatever that's going to be. You get them into some kind of housing that kind of helps them, gradually take baby steps towards becoming a normal human being. Because when you're on these drugs, you're a fraction of yourself. I mean, you're a zombie. Let's be honest. You're just like, you're going from one scenario to the next to get enough money to shoot up the next time or smoke or whatever it is you're doing. Get your hit. You're doing that. And the rest of your life is just kind of, well, yeah, anyway, and so to have these entities getting federal money while they simultaneously hand out stuff that just enables people. It's like I kind of get the clean needle exchange program. Don't shoot me. But from the standpoint of, I grew up during the era of the AIDS thing. And if you got AIDS, you were going to die. And I saw a lot of people literally in hospice type beds at home dying of the AIDS epidemic back in the day. And a lot of that happened in Seattle in communities that were that were impacted by that heavily, Capitol Hill being the most noted. And, to watch guy after guy die, like, we've got another hospice care type deal. And it's like, okay, all right. So, the dude was going to die and it just smelled like death in the room, and I'm there appraising the home. So, it's just kind of part of life. It's like when you appraise an old folks home, a converted house. It's got 15 bedrooms and, they're all used for housing the elderly that need various levels of care. It's just part of life. It's that circle of life. But giving somebody a crack pipe because they're stuck on crack, that to me is just, it's just flat not reasonable. It's like, how did we get here? How did somebody decide, if they're going to do it anyway, let's not judge and let's just kind of let them, sort themselves out because we love them so much. We love them so much, and here's a way that you could do drugs better. Like, it's just so wild. So $5 million in PPP loans, including 2 organizations that received $1 million each. The federal government distributed $800 billion in PPP loans during the pandemic. And we wonder why we have a little inflation. Right? I mean, you got $800 billion in just PPP loans to businesses alone. And then you dump all this other money into the economy. 7% inflation? Not surprising. It's actually quite reasonable. It's like, all right, this is what happens when you do that to the economy. You've got a society where we like to buy stuff anyway. Let's dole out some money and then let's have a shortage of goods and let's freak everybody out. I actually developed an Amazon problem during the pandemic. I got way too comfortable using Amazon. I got to admit, I've got a problem. I don't know how to quit. One day at a time, right? Now, I'm joking about things that shouldn't be joked about, but literally I buy all kinds of stuff on Amazon now. And I'm like, it's just a touch away on my phone. Do I need it here by 10 o'clock tonight? I can pay $2.99 to have that done. Oh, I need this in my life. My life is not complete unless I have this 3-piece closet organizer with that little hook that I can put that little thing that I don't really know what it is. I'm going to put that little thing on that hook. Oh, my life is going to be so much better. I mean, literally, that's what you do, right? Amazon, it's crazy. So getting back to our regularly scheduled program, Seattle's Downtown Emergency Service Center, a nonprofit organization that conducts outreach to the city's homeless population, they received $1.9 million in PPP loans in 2021. Now, the DESC, they were one of the main components that was running the Morrison Hotel, I believe it was, in the documentary Seattle is Dying by 𝐏𝐞𝐚𝐬. So it's that kind of thing. The Downtown Emergency Service Center, they handle a lot of the homeless issues. And guess what? They also handed out the booty bumping kits a while ago. We're going to get to that. Don't worry. I know. You just want me to jump to that story, and we will get there. It's ridiculous. So is this whole story. So the organizations had distributed 3 kinds of glass to patients who can get 1 kind of pipe a week. Now, we're only handing out crack this week. Yeah, opioids, that's next week. The week after that, yeah, the booty bumping program. So stick around, come back. Maybe we'll do a 2-for-1 deal or something. Oh, do you have frequent flyer? Oh, you do? Okay, yeah, here, you get 2 pipes. The whole thing is just, it's like, what? What are we doing? So the DESC did not respond to the Daily Caller's request for comment on this story. Shocking. I don't get why. San Francisco AIDS Foundation, an organization founded in 1984, received $1.815 million in PP loans. The group distributes materials such as aluminum foil, pipe covers, and Brillo that can be used to create pipes. It also participates in a pipe and syringe program at San Francisco General Hospital, the drug advocacy magazine Filter reported. If maybe you're outside of Seattle, you can do the needle exchange program in our libraries. Read a book, get a clean needle. I mean, what a deal. What a deal. I mean, Seattle's just, we're either coming or going. We're not sure which, but yeah, get your free clean needles. So the company didn't respond to outreach on that article either. The data in general demonstrates the growing acceptance of crack pipe distribution as a component of a harm reduction approach to drug policy, in which advocates provide users with paraphernalia and a place to consume drugs with the goal of decreasing communicable diseases and overdoses. Come on down. Shoot up here. You have an OD? We'll help you out. What could be better? We love you, man. You know what I mean? It's kind of like, what if we tried to help them get off the drugs? Whew. Yeah, no, we're not doing that. Opponents of the approach argue that it subsidizes drug use, crime, and homelessness. And fourth, does not help users and addicts lead healthier lives. Let's take a look at that. So subsidizes drug use. Well, that is literally what we're doing. They don't have to pay for a pipe. They don't have to go steal a pipe. You're giving it to them. Crime. All right. So we're enabling them to use more drugs, and in order to pay for their drugs, the city and governmental entities will give them, a big allowance to do their drugs. But yeah, at the end of the month, they'll run out. So they got to resort to crime to get more drugs because they're addicted. And this is just how that cycle goes, that endless cycle. So crime, yeah. Homelessness, yeah. You don't really give a rat's ass about anything else in your life, and you're willing to sleep in a tent, shoot drugs. So there's that, and does not help users and addicts lead healthier lives. Well, so maybe they don't die of an overdose there at the injection site. All right. Maybe they are using cleaner needles. Okay. That is technically correct. Let's be reasonable. This is just some real nonsense. You're just enabling people to continue some extremely harmful patterns that are eventually going to kill them, especially with fentanyl out there. And you can't tell me. With fentanyl out there on the streets, people are dying in droves. King County alone had 638% increase in ODs from fentanyl last year. I mean, and those numbers they're not going to go down. At some point in time, you're going to have to go, this harm reduction, this doesn't, I hate to say it out loud. It's kind of like the Saturday Night Live when they were questioning whether we should be wearing masks or not, or whether the vaccine mandates really did any good. They were questioning that out loud. It's kind of like questioning these people. Well, maybe the harm reduction policy, we've kind of been overrun with homelessness and drug addicts and crime. We've been overrun there. So maybe the harm reduction thing, maybe it's not working out. Yeah, there's that, right? The harm reduction approach is most commonly associated with the distribution of naloxone, which prevents opioid overdoses. Narcan is the one that I'm most familiar with. That is literally, do you remember back in the day when you're watching Pulp Fiction and Eric Stoltz and his girlfriend are trying to revive, who are drug addicts, or not drug, yes, they are they're drug dealers. Let's not mix terms. They're drug dealers, and they are John Travolta's drug dealer, heroin, drug of choice. And he brings in the girlfriend of his boss, who is like he's a criminal drug lord kind of guy. And he's a bad guy. You don't want to, you were tasked with babysitting his girlfriend while he's out of town. And now your girlfriend ODs on your heroin that she thinks is coke. She snorts it. Remember that scene in Pulp Fiction? Oh, not good. Well, Eric Stoltz, he does the old, whack to the chest with the needle full of Narcan. Girl comes, who was that? I forget who that was. Comes back to life and everybody's happy. That's Hollywood. Doesn't always happen. But Narcan, yeah, that's a thing. I mean, if you've got somebody in your life, you may have one of those needles around to inject them. It is not uncommon in the world of people smoking fentanyl or whatever it is, because sometimes you need to pop them back to life. Horrible. In recent years, public health officials have expanded such programs to include injection sites, where drug users can be monitored in case of an overdose, and safe smoking kits, which include mouthpieces for crack pipes and, in some cases, the pipe itself. We are literally using taxpayers' dollars to hand this stuff out. Following a report from the Washington Free Beacon, the White House denied that crack pipes would be included in smoking kits provided by nonprofit organizations. Union Press Secretary Jen Psaki claimed the kits would include alcohol swabs, lip balm, other materials to promote hygiene and reduce the transmission of diseases like HIV and hepatitis, and also a crack pipe. Yeah. So, and it goes in to talk about administrations and, okay. So, although needle exchange programs have been successful in decreasing the spread of diseases like HIV in limited circumstances, the spread of other harm reduction policies has had wide-ranging negative effects. Science journalist and author of San Francisco, I always say San Francisco, it's San Francisco, Why Progressives Ruin Cities. The author, Michael Schellenberger, told the Daily Caller, I have been reading this book. A number of you said, hey, you got to check this book out. It's a good book. I like it. The very first paragraph of the intro is just all about CHOP. And I'm like, all right, my kind of book. Hey, I was there. Schellenberger pointed to the recent overdose death of a 16-year-old girl near a supervised consumption site in San Francisco. The girl had traveled to San Francisco from Stanislaus County, more than 100 miles away, and her parents had previously declared her missing. So she had some drug issues, and that happened. 2 of the streets are taken over by open-air drug dealing. There are significantly more drug dealers there now than before. They created the supervised consumption site. Schellenberger is saying about the Tenderloin district. The Tenderloin in San Francisco, if you watch video of that, I mean, that's basically all it is, a bunch of drug dealers and drug people and just, zombies walking around. I mean, it's just crazy. And they're trying to clean up the Tenderloin. Good luck with that. I mean, it's like trying to clean up 3rd Avenue in Seattle. Good luck with that. I mean, it's a total state of lawlessness. But city officials are nevertheless allowing drug users to consume illicit substances at the Tenderloin Linkage Center, even though under both state and federal law, it's illegal. It's not reasonable. What we're doing is not reasonable. It's like, it's not really legal-ish, but if you just want to scoot right over there, a drug injection site, and here's your clean needle. I take 2, the 2 for 1 day. Oh, you got frequent flyer miles? Okay. You're set. I mean, you're going to be good to go here in just a second. Hold on. Got to wait for the next user. How's that work? New York harm reduction educators, which received more than $773,000 in PPP loans, operates 2 drug consumption centers in New York City. If we don't create spaces like this, if we don't acknowledge that people are using drugs in the United States and create safe spaces, then we will continue to lose people we love, she said. Right. But if you do enable people to continue using drugs, you're going to lose them. Period. We know that. Creating safe spaces so they can go do the drugs, that doesn't really help them in the long term. Got to get them off the stuff. Got to get them off. Yeah. Anything else is just like, they're good people. They've got a small little problem. Yeah, we try and help them out as best we can. Yeah, with paraphernalia? No, I don't think so. Schellenberger, the author, San Francisco, pushed back on the idea that supervised drug consumption sites, which have been piloted in countries like Canada and the Netherlands, create a safer environment for most drug users, or that they allow users to live healthier lives. Nobody shooting up on a regular basis or smoking up on a regular basis is leading a healthy life. One where that next hit could kill you. That's reality. That's the harsh reality. If you're doing those kind of drugs, you could die any given day. So there's that. So you've got that versus these, government funded entities who are like, it's okay. There's no, Schellenberger saying they have no evidence of that. There's no way to know because we don't know what the person who overdosed inside the site and was revived, often at an ambulance on the way to the hospital, would have been revived or overdosed in the first place, he said. They're misleading because people do die. They're just recording the place of death as the ambulance or the hospital. They don't really do that, do they? They do. I'm sure they do. It wasn't at the injection site. Don't put that. You got an eraser on that pencil? Let's erase that. And let's go with the ambulance or at the hospital. Just pick one of those. Just write it down. be good. The Netherlands does have 28 drug consumption rooms, but they're within a broader system that tries to get people to quit using drugs and uses coercion to motivate people to stop using. I say use whatever means necessary. If somebody's addicted and their life is spiraling wildly out of control, don't hand them a pipe. That's just my thinking, though. Reasonable. All right. That's the meat and potatoes. Here's the dessert. The dessert is, and this is a podcast I did a while ago, and it's so crazy. It's so crazy that yeah. All right. Jason rants, Seattle homeless shelter buys heroin pipes with city funds, teaches rectal injection method. Yes. Yes, they did. And everybody's like, what? I mean, it's like when you're a kid and you're like, Mom, why are you putting Vaseline on that thermometer? What are you doing? That's a different alternative injection method, isn't it? Yeah, it is. So there's that. And new at the nav. This is literally a flyer that is posted on a wall. New at the nav. Booty bumping kits. These are a good choice if your veins are hard to hit, meaning you've done so many drugs and your veins are collapsing and you just can't revive them. I mean, you need to reimagine and rethink your approach here. And booty bumping kits, it might be something you want to check out. They're less risk of infection and abscesses. Oh, you're selling me now. Get rid of those abscesses. Ugh. Less damage to the skin and veins. Okay, you're talking my talk. Doesn't leave tracks. This is literally a page promo on a wall. The next one is new at the nav. Heroin pipes. All right. Smoking is a lower risk alternative to injection. Give it a try with an exclamation point. Okay. So you imagine walking into what looks like a normal building and somebody hands you a rectal insertion kit, and okay, all right, yeah, okay. So smoking is a lower risk alternative to injection. Give it a try. Now you can get literally, this is something that happened in Seattle a while back. When was this? This was February. Oh, this is exactly a year ago. Happy anniversary, rectal booty kits. Seattle-backed homeless shelter is instructing addicts to smoke heroin and inject drugs rectally, and the shelter is using tax dollars to help get addicts high. That's about all you need to know about that. And that was the Downtown Emergency Services Center passing out heroin pipes and so-called booty bumping kits. Doesn't that sound like something that should have been left within like the Wolf of Wall Street? Probably, right? If you saw that movie, you know what I mean. It's like, oh, okay, well, that is a new approach. Okay, all right. Booty bumping. And we're not talking out on the dance floor. Yeah, maybe we are, but, to each their own. But, yeah, crazy. So I'm a hard no-go on any of this crap. That's kind of the bottom line. Any other than giving people something towards trying to help them get off drugs, we're not meant to be addicts alone in a tent on the sidewalk in a strange city we don't know because we somehow ended up there because our drug-addled minds got us there. We're not really meant to live that way. And so to me, the best thing you can do is whatever it's going to take to get that person the help that they need. That seems reasonable to me. Handing them a pipe, not reasonable. No, not going there. All right. That's it for me on this one. I'm going to end it like this because it's just not reasonable. Period. End. Done. End of podcast. All right. Thanks again for being here. We'll catch up soon. Talk then. Bye for now.